Dealing with back pain is enough to ruin anyone's day, and dealing with constant back pain can affect your whole life. So today we're talking about some less invasive solutions with Doctor of Osteopathic Medicine, Jocelyn Idema. Thank you so much for joining us.
Thank you for having me.
So tell us a little bit about osteopathic medicine. What does that exactly mean?
Osteopathic medicine is just a different form of how medicine gets taught. You have your medical doctors, your MDs, and then you have doctors of osteopathy. We go through the exact same training, the exact same residency, but it's just a slightly different way of looking at a patient. And I'm actually kind of excited because Liberty University is building a medical center, and they're going to have medical students as osteopathic medical students. So I'm very excited to hopefully be a part of that program when it becomes in full form.
And I understand kind of osteopathic kind of means that you're trying to find less invasive solutions.
Well, osteopathic just means we take a look at the whole body, the whole person, and even though you're complaining of knee pain to me, could you be having something going on higher up in your body that's causing knee pain, or is it more of a psychological thing that you're manifesting as a knee pain? We kind of look at the whole person rather than just focusing on what you come in and complain about.
And speaking of which, I read up a little bit about back pain, and sometimes back pain can mean a million different things.
That's right.
Are you kind of like Sherlock Holmes? Are you searching for it?
Sometimes patients come in from their primary care and they're convinced it's their back, and over the course of asking questions, taking x-rays, it can be their hip that's masquerading as back pain. It can even be something like their kidneys masquerading as back pain. So it really is kind of searching for what is the cause and is it really related to their back.
Well, if somebody's suffering from back pain, when do they need to go to their doctor or see you?
Well, usually by the time they see me, they've gone to their primary care, who's provided them with pain medication, probably sent them to physical therapy, and at that point, if they're not feeling significantly better, they should probably come and see me. Most back pain people experience at some point in their life, but it resolves on its own, usually within about 6 weeks. So if you've gone 6 weeks and it hasn't gotten any better, you've gone through pain medication and physical therapy, probably time to come see a specialist.
And so what type of patients do you usually see in your office?
I see any range of patients. I have young patients who have gotten hurt on the job or maybe did some weekend warrior activities, and they have herniated discs. And then I have older patients who come to me because they have a lot of back pain related to the arthritis in their back, or even have trouble walking because of what we call spinal stenosis that starts to affect their legs and how their legs work.
Now, some of the doctors we've talked to in the past say that you need to actually get ready for surgery. Do you find that true for the types of surgery you deal with? You know, you have to build that strength up for it?
Well, some people do. Older patients can become deconditioned just because they're not able to walk as far, and then after surgery they may need some rehab. Even younger patients, if they've had severe leg pain from their herniated disc and they haven't been able to do as much because of that pain, may need to have some rehab afterwards. But that's the nice thing about the minimally invasive. There's not as much of a recovery time afterwards, and we can get you back doing what you need to do a little bit faster.
And it must be pretty exciting to work in the medical field, to see technology grow. What have you seen change as you've been there?
Well, as I was a resident, we were really perfecting knee replacements, hip replacements. We've done really well with treating fractures, hip fractures, arm fractures, all that sort of fun stuff. But no one's really tackled a really good way to treat back pain. And so we've gone from the big open surgeries to the minimally invasive surgeries, and now we've gone to replacing discs, maybe hopefully doing some disc regeneration, which is right now in clinical trials. So we're waiting for the results of that. It'll probably come out in the next 5 or 10 years. But it's always a developing, changing, and that's exciting to me to be a part of that.
I had a friend that needed back surgery, and she kind of waited, and she was really nervous about it. What do you suggest people do in that time period? You know, how do you know you're finding the right physician for you and somebody that knows what they're doing?
I think you do some research. You know, there's some good websites on there about, you know, researching who you're going to see. Definitely find somebody that you're comfortable with. Obviously, you don't want to be in conflict with the person that you're trying to work with. You have to have a trust with that surgeon. But I always offer, if a patient's coming to me and we've reached the point where I think they need surgery now, I offer them to talk to a previous patient who's had a similar diagnosis and has undergone surgery. Talk to them about what the experience was like. What did they expect before and after? How are they feeling now?
Very good point. Well, thank you so much for your time.